Good evening and welcome everyone. I'm just going to wait a few minutes for us to, for people to just come on. I believe that we've been having a great time. Well, I have. It's been fantastic and wonderful to have the opportunity to just talk to us and educate us on mental health issues. Because I think we're going to do this a bit differently coming up, which is to put out the topic that we will be discussing, put it up so that people can send in their questions. I think I'm going to do that next week for the last edition for this series. So, just by way of introduction, I am Dr. UnderstandADHD. I'm a consultant psychiatrist and a psychologist, and this is a mental health education program that is called Question and Answers with Dr. UnderstandADHD. And this is brought to you by the Grace Hill Place Hospital, a mental health facility that is focused on the treatment of different forms of mental health issues, ranging from depression to bipolar disorder to schizophrenia to personality disorders, to children, psychiatric issues, and also we are focused on the treatment of substance abuse. So substance abuse addiction, we also focus on that. So today, I don't know how they do this, but let me try this. I think that's where you pin your comment of your comment. Okay, I'm not saying how you do that. Just wondering, how do I pin my comment? Well, okay, so thank you everyone for joining in live on Facebook and also joining in live on Instagram. Today I will be answering the topic on adult attention deficit hyperactivity disorder. Adult attention deficit hyperactivity disorder, otherwise called ADHD. I'm here trying to coordinate a lot of things and making sure my children don't talk in the background so they don't come into this conversation. Kind of distracting sometimes. So yes, I'm going to be talking about ADHD, which is the adult deficit hyperactivity disorder in adults. Now, but I can't talk about this without kind of just briefly talking a little bit about what happens in children. So you get the point, I mean. Yeah, thank you, Chika. You get the point. Now, so I can't talk about this without really talking about what happens in children, and because many times attention deficit disorder is something that kind of starts out in childhood or in adolescence and then goes on into adulthood. And even though some statistics say about 50% of those who are diagnosed in childhood may grow older and may not necessarily be diagnosed in their adulthood. That means some of the symptoms they have in childhood will generally reduce as they grow older. But the truth is that more often than not, it's just kind of evolves, but it's still there. So let me just go straight into it. So what do you see when we talk about attention deficit? The diagnosis or the name of the disorder kind of just even covers the entire thing that you will see, or that you will really see in this individual. That's the name of the disorder, kind of shows you what you will see in the individual. So the name says attention deficit hyperactivity disorder. So there are three cardinal things that you will see in this disorder. There are three cardinal things. Number one, some level of impaired attention. The individual finds it difficult to stay focused on things. Number two, there's some level of hyperactivity. That is, there's restlessness. I'm going to describe it a little bit further, but there's some level of restlessness or restiveness, as they say. And then number three is some level of impulsiveness. So the person is impulsive in their behavior. Now that is basically what you see in attention deficit hyperactivity disorder. But let me take it now a bit further. So this starts out in childhood, like I said earlier, and then goes on into adulthood. But an adult that will have attention deficit disorder will display some form of they will display some form of procrastination. Remember I said that this individual is having problems with attention, having problems with impulsiveness, and having problems with the activity in itself. So they will display some level of impulsiveness. Just give me 1 minute. I need to do this briefly. There will be mood lability. Mood lability just means they will have some form of depression. Back. Okay, the internet on Facebook just keeps going on and off. So we'll also have some form of irritability, poor attention, poor organization. Those are the things you will see in an adult that has attention deficit disorder. All of this behavior in someone with ADHD in adulthood will most likely affect, and you will see it affect the person's work, the person's school. So if the person is in school, it will affect the person's school activity, it will affect the person's work, and it could also affect the person's relationships. And because people with this disorder also, you will also see some level of impatience. So those are some of the things you basically see. Now, open to all of the questions that you want to ask. This is going to just be a brief conversation today. So these are the things you will see in an adult with ADHD. They are impulsive, they are restless, and they struggle with attention. And because they have these three things, they also tend to procrastinate, they tend to be poorly motivated, they tend to have moods. People with ADHD sometimes also have comorbidities. What that simply means is that you will have other symptoms showing out in people with ADHD. For instance, you may have someone with ADHD struggling with depression. You may have someone with ADHD struggling with anxiety because of this lack of, because of this lack of attention and this hyperactivity and this restlessness and inability to kind of follow through a task starts out and this thing showing out in their relationship. So this is what you may have. For instance, someone in a relationship may find it difficult to focus on what the other person is saying, and therefore miss out on some things. So this is very key, because if you are dating or you are married to someone who has ADHD, and then you tend to have that person forget things, not pay attention to details, not follow through on their promises. These things you may read them as they may be problematic to you. So you may read them as very upsetting, because you feel like the person doesn't take you seriously. The person is always breaking their promise. The person doesn't keep their word, and the person doesn't start out something they are supposed to do. Now that is because many times people with ADHD kind of struggle with some kind of belief. Remember that because they kind of have challenges in their workplace. I once had someone who said he literally had to keep writing things, and being in meetings was quite terrifying for him, because he's concerned that I would not be able to keep up with the amount of information. And that's one thing that you see in ADHD in adulthood. So the person who is struggling with inattention, is struggling with their capacity to stay attentive, and therefore is scared that it will play out. So the person is struggling with a disorder, and that disorder is impacting on their work. And because it's impacting on their work and impacting on their relationship, sometimes it comes back to impact on how they view themselves. And so I'm going to kind of round up with some of the tips that you can do if you are struggling with ADHD, the things that you can do. If this is your life and it's persistent, not like it occurs once in a while. It happens in a lot of settings, in relationships, happening in your relationship, it's happening in your workplace. You're finding yourself being restless. You're finding yourself, that's with a lot of activities, and you're finding yourself procrastinating. Like I said, these are the things you will see: procrastination, poor motivation, irritability, poor attention, poor organizing skills. The person is in, so because the person is not good at organizing, you also see a lot of clutter. And if you don't understand these things, and maybe you are dating someone or you're married to someone who's like that, you may tend to see them as very dirty, and you may use those kind of words, and it's not going to necessarily help the person improve. So these are the things I want to leave us with. Please, if you want to send in your questions before we round up, I'll be excited and glad to make this a bit more interactive, not just that you're listening out there. Let me know. In fact, you can just just to let me know that you're listening. You could say hello, hi. I see a lot of waves. I see some love. Just listen. Thank you so much. So the person who, so these are now self-help tips. You've recognized this is persistent. It's happening for months. It's like what you would call like the person's nature and all of that. I mean, ADHD sometimes can be seen as a personality disorder, but it's not necessarily a personality disorder, and so this person is struggling with some level of self-esteem issues because it's affecting his work. In fact, someone reached out to me and was literally scared, because he just kept feeling like I'll be found out, and they would recognize that, thank you, Alex, that person just was just worried that we found out at work, and the lack of follow through and the spontaneity just makes individuals who struggle with this kind of thing worried about themselves, and it's like a self-fulfilling prophecy. So because they are worried they will not be able to do well on the tasks, sometimes they just fail to even start. Sometimes they even resign from the jobs, or sometimes they just fail to be, they don't want to even start up a relationship because they are scared that it's not going to work out. So this is what I'm going to leave with you, just in case, and this is primarily, I'm focusing more on how to manage your relationship if you are someone with ADHD, because that is one of the things it will affect. It will affect your work, it will affect your relationship. The first things first is, please recognize that what you have is a condition. So in other words, it's not your fault. It's not something you just choose to be like that. Before and to expand this a bit further, it is said that the cause of ADHD, though clearly not largely known, but there are some factors that are associated with it. For instance, it has a very high level of being inherited. In other words, there's a strong genetic factor to being ADHD, meaning that most people with ADHD have family members, who also are like them, active, very, just constantly on the high side, and spontaneous, and find it difficult to pay attention and all that. So, and then some have said that it's associated with lead intoxication, maybe during formative years. Some have talked about zinc deficiency that may cause it. Some also have talked about some environments, particularly poor social environment and institutions, can also make one to kind of develop that in early childhood. So, but the major thing is, I know that it's a disorder, and therefore don't see it like you are not your disorder. And I need to stress that that you have ADHD does not mean that even though it leads to it affects your work, and sometimes because it affects your work such that you are unable to follow through with your job, doesn't mean that you are a bad person or that there's something wrong with you. You know, I talked about disorganization, so leaving clutters and someone just sees you like you are just disorganized, and so these are tips that you can do to kind of help you manage it. First things first, like I said, you are not the disorder. The second thing is, if you are struggling with ADHD, so one person said this, and this was quite effective for him. So what he normally would do in his work in school was that, because the class is going on and he's unable to kind of stay with the lecturer, so he would go into class and literally record what is being said and play over and over again. You could try that also if you're in a workplace, or if you are in a relationship, you want to pen down things, you want to just have pointers, things that kind of remind you of things, because it's a bit difficult for someone with ADHD to be organized. You may need to, if you are working and if you are like a boss, a leader, then you could have somebody write those prompters for you, so that you can, or take those notes for you, so that you can kind of remind you. Now, your lack of attention is not that you are being lousy, or you are being arrogant, or what's the word now, you are just being insensitive to the other person. It's just that that's how your brain functions if you have ADHD. The third thing is, if in case you're on medication, and this is quite important. Now, in case you're on medication, because the medications that are used for ADHD, they are quite strong. We commonly here in Nigeria, we use things like Ritalin, we use Concerta. These are stimulants, and they have quite strong effect, whether in childhood or in adults. They come with their own side effects. It is best, if you are not severely impaired, that's if your attention deficit has not severely impaired your functioning, it is best to use it sometimes alternate days, or sometimes you use it and skip the days when you are not pressured. So for instance, if during the weekends you are not required to walk or do all those things, then maybe skip it on those days, because of the kind of side effect that it can have. But if yours is very severe and you have to be on it every day, please be on your medication every day. The fourth thing is this. Now, you may struggle with follow through, which is what comes with ADHD, and that is expected. But the more you are able to stay on a task, no matter how difficult it is, by prompters, by writing down things, by reminding yourself of the consequence if you don't follow through, and all of that, the more you are able to follow through the task. The truth is this: people won't necessarily judge you for the ADHD, they'll judge you for the outcome. So you can work on it, knowing that first things first is recognizing that you have this condition, and recognizing that it's a disorder, it's not your fault. So you need to follow through. Try to do that. And yeah, that's basically it. And in terms of the things that you can do, write prompters, take down notes, give yourself some form of space, because when I say space in terms of timing, you may take you a bit longer to follow through certain things, so give yourself that latitude of time. Then finally, if you are with someone that has ADHD, some of the things that you can do for them is, you also need to recognize that it's a disorder. It's not intentional. Maybe you are in a relationship with someone who doesn't really pay attention, is hyperactive, and procrastinates a lot and doesn't follow through, and there's a lot of clutter, is disorganized and all that. Try and recognize that it is a condition. And so if you recognize that, just repeatedly nagging, it's not necessarily going to make the person more effective. If anything, it's going to affect the person's self-esteem and make the person less effective. You are not going to get the desired result by continuously nagging that you're always following, you always don't follow through and all that. So you want to look into that. You know that it's a condition. It's also good if you are in a relationship with someone like that, you're married to the person or in a relationship with the person, please relate with that individual not as their parent. What that means is that don't talk at them, don't talk down at them like, I'm telling you to do this. Relate with them as a partner. It's a condition they are struggling with, and that way you are likely going to get better results. That way, in other words, when I say relate with them as a partner, is that you don't go like saying something. For example, you don't say something like you're always doing this, you're always doing that. One thing that can really help someone with ADHD, if you are in relationship with them, is because they don't often plan through like long. So you can tell somebody that has an ADHD, for example, you can say, okay, we're going out tomorrow, and the person may have another event tomorrow, and you know that the person has another event. The person may not necessarily put all that, because attention is not their strongest point. So you may want to help them. You may want to be very clear and very specific when discussing with them. For example, you can say something like, so we are going out tomorrow. You also have XYZ tomorrow. So you are putting it out there so the person knows in clear terms how to manage themselves. What if you just say, oh, we are going out tomorrow, and then tomorrow comes and the person says, I have this other thing, and you're wondering, but I told you yesterday now that we're going out, and so why didn't you think it through? And that's part of the condition. The organizing and planning through is not one of their strongest strengths. So there you have it. Those are some of the things you can do. Just as a way of recap, it's a very common condition in childhood, depending on how the criteria they use to diagnose it. Sometimes it's misunderstood, and sometimes people diagnose as, oh, this person has anxiety, or this person has depression, or this person has a antisocial personality. Sometimes those antisocial personality you see is because growing up with this condition, the person may have been labeled a lot of things. It's not serious, doesn't exert himself, if only can pay attention more, he will do better. Those things just impact on the person's self-esteem and forms the person as they grow up. But if you are with them and you watch this video and you understand this, there are ways you can just help them using some of these tips that I've talked about. So there you have it. It's 23 minutes. We have 7 minutes to go, but we don't necessarily have to use all the minutes if there are no questions. Thank you everyone who joined in. Thank you Meso, thank you Alex, thank you Tom Bragg. I think I see Tom Bragg here. Thank you Debola, thank you Chika. I think like the first person to jump in. Thank you so much. I can't see those on Facebook. I don't see the questions. I don't know if questions are coming in on Facebook, but thank you. So same time next week, we are going to same time next week we'll continue our mental health education program. This is going to be done all through the month of April, but let me confess, at this point I'm kind of thinking maybe we need to do this a bit longer. But guys, please send in your questions. It will be quite helpful to have questions, common questions. So we focus on mental health issues and also just generally emotional things, and just empowering yourself emotionally and how to be a better, like they say, be a better human being. That's all psychology and psychiatry is all about. Once again, I'm Dr. Otefia Debbie. Thank you for joining in. Have a lovely evening. Bye. You can say bye. You just say hello. Thank you. Yes. And all of that. Okay.